Pediatrics presents.
Hey guys, it's Dr. Raimunde again, and today I want to talk about a topic that is so very common, and it's a complaint or a concern that I get with many families day in, day out in the office, and it's the dreaded cradle cap. This is also known as seborrheic dermatitis, but basically it's cradle cap, and what it is parents will come to the office and they're very concerned because the kids have either this dandruff thing on their head or scalp. Sometimes it can be thick, it can be yellow, green, and parents want it gone. They want their beautiful little baby to have beautiful baby scalp. But sometimes this is not the case, and they come into the office to see what we can do about it. So I do have a patient here with cradle cap or seborrheic dermatitis, and they agreed to let us record them and see what cradle cap can potentially look like. Now this kiddo has a yellow greenish thick plaque on his scalp. These usually are not itchy, they're not painful, they're just kind of hard to look at for the parent because they don't want their babies to have any rashes or anything like that, which is completely understandable. Seborrheic dermatitis involving the scalp is usually self-limiting and usually causes no other symptoms. If there are any other symptoms, we may be dealing with something different than the traditional cradle cap, and should definitely be evaluated by your primary care provider. Most cradle cap will resolve within weeks to months from presentation. Yeah, it can last months. It kind of sucks, but I promise you it's okay. Your baby will be fine. It does not leave scars and it will be completely fine. If a cradle cap or seborrheic dermatitis of the scalp lasts or persists longer than a year, then we need to consider other causes, such as atopic dermatitis of the scalp, or a multitude of fungal infections can also cause problems on the scalp and should be treated with medication. So speaking of treating cradle cap and treating with medications, what are some things that we can do for cradle cap? So like I said, most of them will resolve on their own. However, there are a few tricks that we can do. Old wives, grandmothers will recommend moms use breast milk, and there are some anecdotal data evidence saying that breast milk may in fact help some cradle cap. Other than breast milk, you can also use a multitude of oils such as coconut oil, baby oil, and what I usually recommend parents do is to apply the oil overnight. So put it on before bed, leave it on overnight, and just gently wash it and brush it off in the morning. My favorite brush is an old soft toothbrush. Just grab a toothbrush and just kind of comb those scales away. Another thing we can do is to use a mild shampoo whenever we bathe our baby's heads. So mild shampoo and just gently massage the scalp. For more moderate to severe cases, I usually recommend a selenium sulfide shampoo about once or twice a week for 2 weeks. The other shampoo that you can potentially use, as long as it's okayed by your physician, is a ketoconazole 2% shampoo, again done 1 or twice a week for about 2 weeks. Usually this resolves it. If it persists after this, definitely follow up with your provider. Finally, the last thing we can do for cradle cap is to use a low potency topical steroid. This is used daily for about a week. And if it persists after that, definitely follow up with us. But again, cradle cap, completely benign, very, very common, not usually a reason to really get too worked up on. But if it is lasting too long or you have any concerns, we definitely should be seeing our doctors to make sure there's nothing else going on, like a fungal infection or some other form of dermatitis. Hope you guys got a little bit out of this. Remember to like, subscribe, and comment, and I'll see you at the next video.